Good morning and Jai Hind to all of you दोस्तों. Friends, my name is Avinash Agarwal and I welcome you all onto my YouTube channel Everyday Economics. दोस्तों, in this lecture we are going to discuss with you Yojana from the month of June 2021. Now in this particular Yojana there are three important topics that have been discussed. One is related to health, another is related to agriculture and another is related to electronic waste management, friends. Right. So these are the important topics that we'll be covering. So in every Yojana, basically what we are doing is that we are covering the most important topics that have been discussed in that particular that have been discussed in that particular edition. Right. So that is what we are going to discuss over here, guys. All right. So let us start. Okay. Now, so far as sustainable health is concerned, okay, let us see what they are trying to teach us over here. So far as sustainable health is concerned, right? So there are some basic facts regarding the healthcare scenario in India that we must be able to uh, talk about comfortably in our answers. All right. So non-communicable disease such as heart attack, cancer, right? So non-communicable disease, they lead to death of 41 billion people globally each year, right? 70% of all death in the world is because of non-communicable diseases, right? Now, when you look at the middle and low income countries, so the burden of non-communicable disease related deaths are even more, dosto, right? So NCDs are a major trouble and we need to tackle NCDs. All right. India's per capita public expenditure on health is just rupees 1657 in nominal terms as compared to 5000 in Sri Lanka and 3500 in Indonesia. This is very important. This shows that the level of public expenditure on health is very low. Right? We need to increase that. Public expenditure is, let us say, expenditure done by various levels of government on the healthcare sector. If this public expenditure increases, if this public expenditure increases on healthcare, then automatically better services will be available, better infrastructure will be available, better healthcare will be available. Automatically it will be available, right? India has just 7 doctors for 10,000 population. This is another very important figure which you should be able to quote, right? So, of course, it is going to be very difficult to remember the figures for Malaysia, Philippines, Vietnam, and Singapore, right? But at least this figure can be quoted, right? Doctor to population ratio in India is 1 is to 1400 in urban areas, 1 is to 11,000 in rural areas, and WHO recommends 1 is to 1000, right? So not only is the WHO recommended ratio is not achieved in urban areas, definitely it is not achieved in rural areas, right? 1 in 11,000 in rural areas as compared to 1 in 1000 that the WHO is recommending. 1 in 1404 in urban areas as compared to 1 in 1000 that WHO is recommending. Another very important hard hitting figure, right? WHO recommends that there should be 44.5 health workers per 10,000 population so that the sustainable development goals can be achieved. India is having only half of that, right? Another very important figure, right? According to WHO, between 1990 and 2015, undernutrition or malnutrition is the major cause of death in 45% of all death among children aged below 5 years. So this is something that we have already studied in one of the recent classes itself, because I remember talking about this back then also, right? Just hold on. In India, the prevalence of underweight is still quite high. In India, the prevalence of stunting is still quite high. If you look at mental health, right? If you look at mental health, right? So lifetime prevalence of mental illness in India is also quite high, right? And a good number of suicides unfortunately are taking place in our country globally. If you look at our performance on the global hunger index, so it is not really up to the mark, right? So now these are all facts, okay? Now these facts can be very useful in the introduction or in the body or in the conclusion of your answer. You should be able to use facts selectively and strategically to strengthen your answer. That is the kind of approach that you need to take, right? Non-communicable disease का definition has been provided to you over here, right? So non-communicable disease is a disease which is basically not transmitted. It is not transmitted from one person to another directly, right? So they can be genetic diseases, they can be lifestyle diseases, right? Like for example, right, diabetes, hypertension, Parkinson's, kidney disease, heart disease. These are all non-communicable diseases, right? It's not as that I'm going to sneeze and you will get a heart disease because of me. No, right? So non-communicable diseases, they cannot be like, transferred from one person to the other, dosto, right? Out of these four categories, right, that is cardiovascular diseases, cancers, respiratory and diabetes. This is the reason for 80% of all premature deaths. Cardiovascular heart disease, right, cancer, respiratory disease and diabetes. For 80% of all premature deaths. So we need to work on these diseases, right? So this is these non-communicable diseases. They are also referred to as diseases of the rich, right? Because NCDs are predominantly associated with the richer class of society, right? So communicable diseases, they are spread because you are not having hygienic food or pure water or clean surroundings. But NCDs on the other hand, they are because of genetic factors or consequence of fast-paced life without adequate concern for health, dosto, right? It is this fast-paced, hectic life, right? And the kind of food that we are eating, the kind of sleep that we are having, the kind of worries that we are having, right? So, because of these reasons, these non-communicable diseases, they get generated, right? What is the reason for the spread of non-communicable diseases? Fast-paced life, urbanization, right? Running behind high-paying jobs, not having leisure activities के लिए time, right? Being under stress all the time, right? That is one of the major reasons. Job targets, right? That creates a lot of stress, right? It creates a lot of depression, mental issues, right? Insufficient physical activity, right? Contemporary jobs, they focus on brain activity, right? You need to, like for example, you need to sit in your chair and think and think and think and think. So a lot of brain activity is there. Hardly any physical exercise is taking place, hardly any physical activity is taking place, right? Unhealthy junk food, right? So globalization, so food habits have been deteriorated because of globalization. McDonaldization or Coca-Colanization of the world has taken place. So everybody is dependent on McDonald's and Coca-Cola, right? So knowledge and appreciation of culture is a positive effect, right? But unhealthy junk food ka spread is something which is totally avoidable. Smoking, usage of tobacco, right? So chewing tobacco, smoking tobacco, right? Pollution, it's another major reason for respiratory diseases, right? Unclean fuel in rural areas, pollution, etc., right? So these are the major reasons, right? Now studies have pointed out that this transition has taken place in the prevalence of NCDs, right? So 7% of India's population had diabetes, 10 to 15% were having early signs of diabetes, right? And high GDP more means higher diabetes, right? So states in India which are having a higher GDP, they are having a higher prevalence of diabetes, or the trend is that they will have a higher prevalence of diabetes. That is a major problem, right? So this is the basic thing that we need to be aware of, right? Now, if we provide healthcare for all, right? Healthcare for all the citizens of the country, so that will be a very desirable step in the right direction, right? So, of course, health sector has always received top priority in our discussions, right? So there is this Alma Ata Declaration in 1978, right? And in this Alma Ata Declaration of 1978, they have defined health. So this is very important. This can be, something you can use your, this is a point which you can use in your introduction, right? So how do you define health? So let us say that tomorrow if you are dealing with any answer related to health or healthcare, right? So you can always start with this kind of a discussion or this kind of a definition, that as per the Alma Ata Declaration in 1978, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And then you can develop your answer further ahead, right? So starting with the definition, your introduction, start being incorporating a definition, it can be a very positive start in the right direction, दोस्तों, right? Article 3 of the Universal Declaration of Human right? What does this Article 3 says? That everyone has right to life, liberty and security of person, right? Supreme Court of India itself has said that right to life includes right to food and health. So you can basically understand that right, so health is basically a matter of human right? It is associated with your right to life, right? So this is the basic thing that needs to be kept in mind. There are many other countries, there are very good examples, right, like that of Thailand and that of Cuba, where universal health care without any charge is being provided since 2002, right? And 77% of all hospital beds in Thailand are in the public sector, right? Similarly, Cuba, they have a compulsory service for doctors and nurses in rural areas, and there is a sustained drive to get old people with cataract operated in public hospital, right? So Cuba is basically trying to fund the primary healthcare system completely through the government coffers. Okay, so there are other countries who are doing remarkable job so far as providing universal healthcare free of cost is concerned, at least at some level of service, at least at some level of service, if not the complete spectrum of services being provided free, at least some level of services are being provided free in a comprehensive manner to the entire population. And probably that is where we need to move if we want to improve the scenario of healthcare in our country, right? Now, what are the traditional challenges that are identified in India's healthcare sector? Those traditional challenges should always form a part of your answer. So the first problem is retreat of the state or the expenditure. The public expenditure has not really kept up, right, with the requirement. So because of the spread of capitalism, because of the spread of market economy, because of the retreat or because of the backward movement of the state, because of the reduced expenditure on the welfare functions, because of the reduced expenditure on public health and so on, right? So the public health system has undergone a decline, right? So doctor to population ratio in India is absolutely pathetic, right? And one of the major reasons is that state or the government is not really having expenditure which is up to the mark, right? That is what we have discussed over here. Low health expenditure, you can repeat this point. There is therefore a demand supply mismatch, that the demand for healthcare is there, but the supply of healthcare is not there. There is inadequate coverage of health insurance. So if I fall sick and I don't have insurance, then I have to spend money out of my pocket. And if I don't have money in my pocket, I can't spend it. If I can't spend it, then I cannot purchase the required healthcare, and therefore I will be left untreated, uncared for, right, and undiagnosed, right? So as a result of which, what will happen is that the disease burden on me will increase, and that will basically deteriorate my quality of life. That will basically make my life not really worth living in many cases, right? So inadequate coverage of health insurance can be catastrophic so far as your health related outcomes are concerned, right? Again, this is linked with your out of pocket expenditure, that somebody has to pay for healthcare. So if not the insurance company, if not the government, then who? Then you, right? Why? Because you do not have health insurance. There are also various malpractices in the medical profession by the medical professionals within the medical fraternity, right? Prescribing unnecessary drugs, doing unnecessary surgeries just to inflate the bill in the hospital, right? So these are the kinds of malpractices that should be thoroughly curbed, right? What is the conclusion, right? So the conclusion is that as the economic growth progresses, right? So there is a need to monitor the population against the risk of spread of NCDs, right? So people must be made aware of the healthier life choices, right? You should be more active, you should have a more fulfilling life. Because see, at the end of the day, health is wealth, is what we understand, right? So need to focus more on health, right? Having a healthier workforce and a healthier population is always more, it's always much desirable, dosto. That is something that we need to understand. So this is a very decent and a very comprehensive kind of a discussion on healthcare. healthcare is an important topic in our examinations, right? And you can always be expected to write an answer or maybe even an essay on healthcare, and everything that we have discussed above can be very useful, right? Now there is something called as smart agriculture, right? Like for example, recently I remember that in one of my other classes, I was talking about smart urbanization, right? So similarly over here now we are talking about smart agriculture, okay? Because see, this digital thing is coming along in almost every field, right? So absolutely in every field the level of smartness or the level of incorporation of technology, खासकर digital technology, can be done, can be enhanced, right? So computer systems and artificial intelligence and machines and softwares and protocols and stuff like that can find greater and greater application in various fields. And to that extent, human brains and human cognitive processes can be supported via these machines and via these processes. So that is probably what smart agriculture is all about. So smart agriculture basically involves usage of technologies, tools, so that yield, efficiency, and profitability in the company in agriculture can be improved. Right. So what is yield? The production that you are carrying, that you are getting from, let us say, per hectare of land. Efficiency means that if you are putting in X amount of inputs, that you should at least get Y amount of output. And profitability means that there has to be at least a minimum return on your investment that you have done in your agricultural operation, right? So basically we want yield, efficiency and profitability to be at an optimum level, at a sustainable level, right? So to achieve that, if we can use certain technologies and tools which can help us in achieving that, then that can be great, dosto, right? So this term is not very popular, but there is a lot of potential in the long term, right? That going ahead we can adopt a lot of technologies, right? And make life easier for the farming community, right? So Iskandar, what is going to happen is that we are going to collect a lot of data using sensors. We will be diagnosing the collected data. We will be trying to extract intelligent information from the data. We'll try to take decisions with or without artificial intelligence, right? We'll try to implement the steps that need to be implemented, right? We'll try to automate the repetitive actions. So like I was trying to explain to you, that we are ultimately talking about utilization of machines, tools and processes, right? So that we can sort of make the decision making process better and faster in agriculture, right? So Internet of Things, right? So monitoring of soil moisture, chemical applications, livestock health monitoring, etc., can be done via Internet of Things, right? So farmer can get real-time information and can therefore take better decisions, quick decisions, big data, right? Large volume of data gets generated in the agriculture sector, right? If this data is properly analyzed, so it can aid in decision making, right? Artificial intelligence, right? So we can automate the traditional processes, right? So in weather monitoring, okay, so systems are able to predict the chances of surplus and deficit rainfall in the current year. Machine learning, right? So application of technology, right? So researchers have been able to make machines learn to distinguish between healthy plant and infected plant. So we can scan the leaves and this detection can be done. So instead of time consuming pathological analysis, right, handheld scanner, they can tell us which plants are healthy, which plants are unhealthy. Usage of drones and sensors, and there are other technologies as well, right? So you need to be able to mention these technologies as a part of your answer, my friends. There are various initiatives that have been taken up by the government to smartify agriculture, if I may, right? So for example, soil health card, right? So it tries to impart knowledge about the soil, about the nutrients required, about the nutrients present within the soil. So there are a network of labs in the country, right? And they are involved in taking informed decision so far as agriculture in India is concerned, so far as soil health in India is concerned. Then there is ENAM, right? There is direct benefit transfer. There is agri-tech startups. And this is a very important point, right? So this is an important point. I remember that there was something related to Microsoft and AgriStack or something like that, right? So you can probably talk about that as well. Okay, so not very great number of initiatives are there right now so far as smart agriculture is concerned. So even if you are able to explain like two, three initiatives, that should be more than sufficient, right? What is the conclusion? The conclusion is fairly straightforward, right? That the population will increase, so the yield is going to be important, food security is going to be important. In this scenario, dependent dependability of agriculture and traditional systems, right? That needs to be decreased, and if we can use advanced technologies to our benefit, then that is always more desirable, right? So that is the kind of approach that you need to take in this particular topic. It's a fairly straightforward topic. It's not difficult. Most topics are fairly straightforward topics. They're not difficult. It is just that we need to have the right content, and we need to be able to revise the right content, recall the right content, revise the right content, write it on a regular basis, and then life should be easier for us, dosto, right? E-waste management, this is another headache, dosto, right? So the point is that there are certain basic facts that you need to be able to know, right? That India produced 1.9 million tons of e-waste in 2015. 95% of the e-waste generated is managed by the informal sector. Now in the informal sector, the problem is that the processes are not really very scientific, you may say. The safety and hazard related precautions are also not really up to the mark in the informal sector, right? And as a result of which, those who are operating in this sector, they are exposing themselves up to various kinds of risks and diseases, because ultimately this electronic waste is also having a lot of chemical pollutants and stuff like that, right? So to that extent, we need to do something about this mounting problem, because more and more number of gadgets are being used and therefore discarded and therefore being converted into waste. So we need to really do something about that, right? Now there is this concept of extended producer responsibility. So if I'm a producer of electronic goods, so definitely my company, my production, my products, they are eventually being converted into waste, right? So as a part of my responsibility towards the society, towards the community, towards the environment, I should be ready to take back the electronic waste that I have generated, and I should be ready to process that electronic waste at my end in a safe and a responsible manner, right? So if every stakeholder starts functioning like this, right, that it is ultimately their responsibility also to take care of this problem that is getting created, right? So then things can go in the right direction. So manufacturers and producers need to be involved, right? So they need to be ready to take back. They need to be able to set up collection centers, or they should come together to basically handle the waste that is being generated, right? So far as India is concerned, if you look at the waste management rules which are applicable in India, right? So there are specific collection targets set for producers, right? So you can always start your definition either with the statistics. This kind of a statistic can be the starting point of your answer, right? Or maybe a definition like this over here can be the starting point of your answer. Either of these two can be the starting point of your answers. What is the reason for the growing e-waste in India? So rapid growth of electronic industry. We are the world's second largest smartphone users. Rapid upgradation of technology. By the time I purchase a new mobile phone, right, within a few weeks time after that, a newer mobile phone, a better mobile phone, a more upgraded mobile phone enters the market. So I get this feeling that my phone is outdated, so I need to probably upgrade myself. I need to change myself, right? 3G becomes 4G, 4G becomes 5G, 5G becomes 6G, right? Shipping from developed nations, right? So a lot of waste gets shipped from developed nations into developing countries. So as a result of which, more amount of e-waste gets piled up in developing countries. Corona pandemic के वजह से there was basically a lot of restriction, right? So this entire waste management exercise, it came to a standstill, right? And predominantly it is being done in the informal sector, because the viability of the business in the formal sector is not really high many a times, because see, ultimately even e-waste management is a business at the end of the day, right? You're going to try and extract something valuable from that e-waste, probably try to sell it and benefit from it. So you want to keep the wages of the workers as low as possible, keep your enterprise out of the formal regulation of the government, pay as low taxes as possible, right? And since you are operating under the radar, right? So there is no question of you providing five-star healthcare facility to your workers and stuff like that, right? So far as viability is concerned, right? Informal sector is the way forward, right? Inferior working conditions, high initial investment, right? Danger to health. Okay, so what we are discussing is that, okay, we are discussing reasons for growing, right? Now these are not really reasons for the growing, so these are the hazards related to the this thing. These are the problems, I may say. These are the challenges associated with the this thing, with the informal sector, right? Because these are the reasons why we are having this thing, and these are the challenges. Going down, we are discussing challenges. So inferior working conditions, high initial investment, danger to health, danger to environment, loss of valuable material, lack of awareness. Okay, so these are the challenges associated with the e-waste sector, my friends. What is the way forward? See, now in India, whether we are talking about e-waste or whether we are talking about absolutely any area, right? We have plethora of rules, laws, and regulations in place. What we don't have is proper implementation, right? So better implementation of rules is required. Creation of proper infrastructure is required. For that, you can, give these kinds of suggestions, that viability gap funding or maybe subsidies, or maybe some kind of a support is required. Formalization of the industry is required, right? So, like for example, right, so we need to disincentivize the informalize for informal sector, right? Responsible e-waste management, right? So we need to work with developed countries, right? And we need to strengthen our own public health system, right? And we need to shift responsibility towards producers, because ultimately they are the ones who are profiting from producing these electronic items. So it is also their responsibility. It's also their responsibility that they help in the management of the waste that is getting generated. Conclusion is fairly straightforward. Our population base is high, our aspiration is high, therefore the e-waste production in India is also high, right? It is quite uncontrollable, you may say, right? And due to the ineffective implementation of the existing policies, rules, and regulations, a very severe challenge is being posed to the environmental sustainability in India, and this anomaly needs to be corrected, and for that effective management of e-waste is required. So you can see that fairly straightforward discussion, right? It's not really challenging, right? You can easily understand these areas. Okay, so three topics are done over here like this, my friends. There is a lecture at 7:35 a.m. right now. In the next 20 minutes, this lecture will take place on the Unacademy platform, right? So you can participate in that lecture. I will share the link of that lecture on my Telegram channel, right, on my WhatsApp groups. So you can participate. I'll be asking you three questions based on the three topics that we have discussed over here, and I hope to see your active participation in that particular lecture. With this, we'll bring this session to an end. I'm sharing this document. Please revise it. Thank you very much. All the very best, and Jai Hind to all of you guys.